The WIMS conference for this year is coming up in just a couple of weeks, and would love to hear from you a little bit about what your vision is for this year in terms of the areas of focus. And I know one of the themes is finding your voice. What inspired that?
So to start, to answer about how kind of making those connections have happened, I think that it's really important to look for people outside your circles. I think that finding heterogeneous people with heterogeneous skills. So for example, at the summit, we have non-physicians who are speaking, we have lawyers, we have health policy people, we have media personalities. And I do that specifically because I think that in medicine especially, we are really siloed and we very much have tunnel vision when it comes to our jobs and our careers. And it's because that's how people become successful in healthcare. You get through med school, residency, and potentially fellowship, and you have to have tunnel vision to be successful. But I think there is a real detriment to our healthcare system when we don't look outside of our groups of interest. And so I've tried really hard to look for people outside of my circle, and I do that by reaching out to people who I wouldn't normally reach out to. It has been amazing the things that I've learned from some of these women and men across the country. We have these two men who are PhDs leading our allyship leadership, longitudinal leadership program, and I met them at a conference I went to, and I said, "You guys are incredible. I want to do something with you." And we couldn't figure out what it was initially, and then 2 years later, I came up with this idea for this longitudinal program, and I asked them to lead it. I never would have had the opportunity to do that if I hadn't just stepped outside of my comfort zone and introduced myself to them. So I think that's a really big thing when it comes to making those connections and connecting people across the silos, is reaching out to people who would not normally be in your circle. When it comes to the summit this year, when we talk about finding your voice, one big thing that happened over the last year and a half is we have seen a flood of healthcare workers' voices in the media, on social media, in publications, just talking about the pandemic and how it's impacted them, how it's impacted their families, and how it's impacted their patients. And the thing that I think is so phenomenal is that many of these healthcare workers are burning the candle at both ends. They're exhausted, they're so tired, and they're taking whatever extra time they have and they're using their voices to educate and attack this misinformation that's all over the place these days. And there's a lot of physicians who've come to me and said, "I don't know how to use my voice. I have all these things to say, but I don't know how to get myself out there."